good morning to all of you. COVID-19 lockdown, travel restrictions, online classes, social distancing, and work from home. All these have changed the lifestyle of millions of people across the world. Today is August 4th, the National Bone and Joint Day being observed by the Indian Orthopedic Association since 2012 to create and spread awareness amongst the public regarding the various orthopedic ailments which could cause disability and hamper performance. This year's theme, Save Self, Save One, stands for imparting medical care to the fellow family members and friends, and also train other surgeons and healthcare workers to save lives across the world, especially India. On this occasion, myself, Dr. S. Dilip Chandraja, consultant spine surgeon, and Dr. Karthi Sundar, senior consultant, arthroscopy and sports medicine, are going to discuss important information on various orthopedic ailments and procedures which we believe could give important information to the public. Hello, Dr. Karthik.
Hello, Dilip.
You specialize in sports and arthroscopic surgeries. We all know that life is movement and movement is life. And especially movement is the backbone of all life in the world. So we would like to know, what is arthroscopic surgery?
Arthroscopy surgery is essentially, you go to the literal meaning, it means looking into the joint. Arthro means joint and scopion is a German term meaning looking into. So it's to understand better, it's the keyhole surgery of all the joints, various joints in the body, namely the knee joint, shoulder joints, wrist, elbow, and the hip joints.
Okay, sir. So we understand that it's a keyhole procedure, and we would like to know what are the advantages of arthroscopic surgery.
Yes, when you compare with the traditional open surgery, this surgery is performed using micro or mini incisions, which is as small as 5 millimeter to 7 millimeter. And the second advantage is we are able to reach the target tissue of damage where we need to do most of the work. We bypass all the normal tissues, whereas in the traditional open surgeries, we may have to surgically dissect a little bit of the normal tissues in order to reach the deeper tissues where we actually need to work upon or repair or do any kind of reconstruction procedures. And as a direct correlation, when the incision is less, any complication, there are certain complications that can occur with any surgery. The rate of complications is drastically reduced when you come to arthroscopy surgery. And the more unique thing is the rapid recovery. The rehab starts immediately. As soon as 6 hours from the surgery gets over, we start the rehab, which cannot be or which should be delayed for a period of around 2 days or 3 days in cases of traditional open surgeries.
So we understand faster recovery, faster rehabilitation is on the go. So what are the common orthopedic procedures which can be performed by arthroscopy?
Knee joint is one area we have the maximum indications for arthroscopy surgery. We repair and reconstruct the ACL, PCLs and the meniscus. And coming to ACL is one of the commonest. ACL reconstructions and repairs are one of the commonest surgeries performed using arthroscopy technique. And we have certain indications in the other joints like shoulder joints where you get throwing injuries, like injuries which result in throwing activities, and in games like kabaddi, you get recurrent dislocation. Kabaddi players get recurrent dislocations of the shoulder. And young dancers, there are some conditions which restrict the maximum movement of the hip joints, where the ball and socket components of the hip joints impinge against each other. Then the range of movement is restricting the dance movement ranges as well. And there are some couple of indications in the wrist joints, elbow joints and the ankle joints as well. But essentially almost arthroscopy is almost synonymous with ACL reconstruction and ACL repairs.
So we understand that ACL reconstruction is the most common procedure being performed. So in that case, are there any recent advances in this ACL reconstruction?
In arthroscopy technique, traditionally it has been a single bundle reconstruction being performed. And now, with more and more understanding of the anatomy and the biomechanics of the knee, we understand the ACL ligament is not just a single ligament, it is a twin ligament structure. So now we have moved from the traditional single ligament reconstruction to double bundle ACL reconstruction, meaning we reconstruct each bundle separately, so that when the knee joint has a huge range of movement from 0 to 120 degrees, so when we reconstruct it using double bundles, we get more stability in the entire range of motion. And the next thing is, we have moved from autografts to allografts. Autografts meaning to reconstruct the torn ACL. We have been so far we have been using commonly the hamstring tendons harvested from the patient themselves around the knee area. In order to prevent the functional deficit, if at all any, even though if it is minimal, we want to prevent the functional deficit in harvesting the patient's own graft. Nowadays we have moved towards using more and more allografts. Allografts meaning the tendons that are harvested from brain dead individuals. We all know the cadaver transplant program, in which is being commonly performed for the liver transplant, kidney transplant, and the heart transplants. Now the orthopedic surgeons have also moved into part of a organ transplant team. Once these major organs are getting harvested from the brain dead individuals, the orthopedic surgeon team also gets in and harvests the tendons and the strong tendons and bones. And now we have a very good bone bank in our country itself. One is located in Bangalore, which stores all these brain dead individuals harvested tendons. So we have started using those tendons which are equally stable, and when we use this allograft, there is no reason for taking the patient's own normal tissue for reconstructing these ACLs.
Okay, sir. So all these ligaments and tendon injuries are very common in sports individuals. So you being a sports surgeon and coming to sports injury as such, when should a sportsman seek medical attention following an injury?
Yeah, in the acute phase, as soon as the injury is happened, we divide it into two: the acute phase and the later phase. As soon as the injury happens, the red signs to be looked for is like local swelling, severe pain, incapacitating pain, and inability to use that particular limb, be it a knee or ankle or upper limb. They will not be able to use the joint any further. These are the things which are looked for as soon as the injury has happened. So these things, then notice these things, then you seek the sports medicine specialist opinion as soon as possible. And sometimes when all these acute symptoms, in some conditions all these acute symptoms subside as early as few hours, then the particular sportsman resumes his play. After the play, in the long time, he or she will be able to experience some amount of giveaway in any joints. Like in the knee joint, there will be a sense of giving away, a sense of wobbling. And when it comes to upper limb, no, one will realize that they are not able to throw or use the limb, they use the same amount of force which they were using before the injury. Then again, even though the acute signs are not there, and then again they have to go and get the sports specialist opinion.
Sir, sport activities have spread across the length and breadth of the nation. So what is your take on sports injury prevention?
Yes, with more and more emphasis on sports now, even from the government level and the parents level, more and more awareness have picked up. And when the amount of thrust in sports goes up, the amount of sports injury rates also goes up. And once we have started treating to a level, we have started treating and understanding the sports injuries and treating it better. Now sometimes we come across some career threatening sports injuries, no, like the sportsmen, they train for decades, like 1 decade, 2 decade, they've trained themselves and come to the level of international and national arena at the end of 1 or 2 decades, and sometimes that they have to prematurely retire because of these injuries. Though we may able to bring them back to sports, some people they are not able to get back to the level of sports in the pre-injury level. So in order to fix this gap, we have pitched in, the sports surgeons have pitched in, and we are forming joint specific injury prevention programs where we are able to prevent the injuries. We have identified the areas in which situation a particular ligament gives away, particular meniscus gives away, and we are trying to fix the gap. We are trying to train the sportsmen so that they are able to avoid these injuries in first place, like improving their balancing, improving their muscle tone, concentrating on the nutrition, concentrating on the warm up and the cool down. So we have pitched into that level to prevent the injuries before happening.
Yes, sir. Please tell us about the role of orthobiologics in sports injury management.
Any joint, to explain, it's a biomechanical joint. Any musculoskeletal system, musculoskeletal tissue always have two components. They have a mechanical component as well as a biological component. And traditionally we have been trying to fix all the mechanical components, and we have been very successful in that. And to push this even further, we are looking more into the biological aspects. So we can treat a fracture, we can reconstruct a ligament. So we are looking into accelerating this process, because the goal of any sports injury management is back to sports and to the pre-injury level. So when it comes to sports, we cannot, the natural healing process in the body takes few weeks to months, and the orthobiologics helps us to accelerate the process. The common biologic agent we use is the PRP, which is being very commonly used now. That PRP, when it is delivered to the local area where there is a tendon injury due to overuse or repetitive use, that kicks off the body's natural mechanism even faster, so that we are able to shorten the healing time, shorten the recovery period, so that the particular sports person is back to the field quicker. So that's where the orthobiologics helps us.
Thank you, sir, for sharing good information on what is arthroscopy and sports medicine and scope for prevention in sports injuries.
Thank you, Dr. Dilip, for the wonderful questions you raised on the awareness of arthroscopy